Hello everyone, thanks again for the great talk we've just heard. Very impressive, very alarming. Now we all want to see what we can do on different levels. There are different actions needed, but now we're going to look into the role of a city. So welcome to our session to the interactive simulation exercise on heat preparedness. I'm Katrin Heil, thanks for introducing me already. My colleague Sarah Splettstößer today will not be in her role as Sarah. She will be the mayor of the city Grand Urbia, Major Tony Francis. So, to support her, please use Slido. For all of you who are not logged in yet, please log in again. You can see the QR code there. We will need your decisions very fast. I will tell you when to vote, but you will also see at the top left corner of the slides when to vote. So, let's start with this simulation exercise. Please all again log in. You can also see the QR codes in this room if you're not logging in here. So, let's start. Welcome to Grand Urbia. As you can see, the city of Grand Urbia is a densely populated city. It actually is the capital of Genovevia, with 4.2 million inhabitants. As you can also see, it lies along a nice river. The neighboring city of the next country is Aurora, and we have parks and green areas outside of the vicinity of the city. However, in the city center, we have a lot of concrete capturing heat and making it quite impossible for the wind to cool it down in the urban city centers. So, usually Grand Urbia has moderate temperatures in the summer, but in the past 10 years it had 2 severe heat waves. One just last year with degrees of 39 degrees Celsius for more than 4 days and 29 degrees during night times. And the city limits were stretched to the limits, city services were stretched to the limits, especially regarding healthcare. It was a very severe situation. Today, we have our mayor of this city here, Mayor Tony Francis. Congratulations, you all are now Mayor Tony Francis. So welcome here, and you all know in Genovevia, mayors have a great power. So you all have great power for the next 30 minutes.
Hi everyone, my name is Antonia Francis, but my friends call me Tony. I'm married with 2 children and they are delightful. I love 60s music, but I'm definitely not good at painting, and my wife really detests the heat. All of this information might or might not be relevant to you. I have really bad memories of the last heat wave. I had just been elected and the heat wave caught me off guard. Grand Urbia has a well-established procedures for floods, but unfortunately not so much for heat. The warning was only received 2 days before the extreme heat days, and 446 people died. And due to the last heat wave in Grand Urbia alone. This was way too much, so I was severely criticized because people felt alone, left alone by my administration, and the excess mortality in care homes, problems in hospitals, lack of warnings, advice for the population, and general preparedness. But for now, it is only mid-April, and this year I will be more prepared for the summer. So let's start this busy day with the usual good breakfast and some music.
All right, now let's come to the weather news. The summer will be nice and warm, but there's the seasonal forecast of the National Meteorological Department that the summer has a 70% of reaching way above average temperatures. According to the experts, the temperatures could reach the levels of last year, when vast parts of the country suffered from the unforgiving heat. So these memories of last year directly come back to Tony's mind, and she gets all nervous.
Oh no, the Heat Health Action Plan is not ready yet. Without official guidance, it will be a nightmare. To get everyone on board and to get financing, I need help, especially for our health and care providers. Okay, I don't want to waste too much time, so let's call Ms. Levy from the Ministry of Health. Hopefully they have some guidelines I can use. Good morning, this is Tony Francis, Mayor of Grand Urbia. I heard on the news that there might be another heat wave ahead this summer. Do you have some more information on that? I need support to prepare my city, and reception told me that you are the expert and can offer some guidance. Are there any official guidelines published yet?
Dear Mayor, thanks for calling. This is Ms. Levy from the Ministry of Health. Thank you very much for reaching out. And you asked me something. After the last heat wave, this was supposed to be a priority, and the plans of guidance should have been ready months ago. But then the pandemic went along, and everyone was working on other things. And just between us, everybody believed that extreme heat is quite rare and that we would have time for the next heat wave to come. And now here we are. We have seen the new forecast, and now we are also preparing as best as we can. So we don't have the guidelines yet, but let me tell you what we already have. So for all of you, please choose now. We have 4 different options, what you can look into it as mayor. So first of all, get your Slido ready, because the first option would be the Ministry of Health has commissioned an interesting study on heat impacts and warning communication. Second, you could also choose that our launching a funding program on climate adaptation and cooling for public buildings. Third, there's another program with subsidies for for greening and shading outside areas. And fourth, we have developed a manual for heat preparedness in care facilities. So all of you, please vote now. Which of these would you like to choose? Would it first be the study? Would it second be the program for funding program in climate adaptation and cooling? Third, the program subsidies? Or fourth, the manual for heat preparedness? You don't have much time. The heat wave is not waiting for your decision, so please vote now. And the poll is closing already in 4, 3, 2, 1. Great. So thanks a lot for voting. I see that most of you voted for the 4th option, the manual for heat preparedness in care facilities. And I can tell you, this is an excellent choice. Ms. Francis, great idea. We are currently preparing our manual on how to change behavior during heat days in the elderly care facilities. We call it the Heat Preparedness Protocol. It will be ready before the heatwave season. You and the Grand Urbia care staff can learn from the manual and improve the setup during heat days. But also let me tell you that the Public Health Information Institute is working on guidelines for awareness campaigns and materials for the public. So you may call them and ask for their support.
Thank you, Ms. Levy. Have a nice day. I had some busy days, but finally I have now some time to call the Public Health Information Institute and ask for their help. Hello, this is Grand Urbia's Mayor Tony Francis. I was referred to you by Ms. Levy from the Ministry of Health. Given the short time that is left, I hope you have some initiatives and information materials on heat preparedness that we can use.
Dear Mayor, thanks for calling. This is Ms. Hato from the Public Health Information Institute. I'm very happy to hear that you, as political representative, see this problem of heat as priority. To be honest, we rarely receive requests on this. And most of our budget has been allocated to information materials for vaccinations during the pandemic. But we do have some things that we are working on. So what do you think about the options we already have? So all of you again, please go to Slido because you can choose between 3 options. First, we have a social media campaign offering behavioral guidance during heat waves. Second, you could also join the International Exchange together with the WHO and the World Meteorological Organization, the WMO, where they talk about heat adaptation on a local level. Third, the Public Health Information Institute is also working on a study on heat impact and adaptation in schools and childcare centers as a basis for new guidelines. So, which of these available options would you like to push forward? Again, would it be number 1, social media campaign, 2, the International Exchange, or 3, the study on heat impact and adaptation? Please all choose now. The poll is already closing since we don't have a lot of time. And 3, 2, 1. Great. So I see most of you voted for the social media campaign offering behavioral guidance. So that is actually a good choice. But we did that already last year, and to be honest, it didn't work that well because it was not reaching our target audience. We could not reach the elderly, we could not reach the most vulnerable people. So I think there are also some other options. Maybe we can take a look into the study, but I think that is not ready. I think maybe that won't be a good idea too. But we have another option, the International Exchange. So take a look into that. You will attend this conference of the WHO and the WMO, and you can learn from the best cases that are implemented in participating cities. So it will be already in early June, So you can participate, learn, and keep that in mind when adapting your city.
Thank you, Ms. Sato, for all the ideas. I have another question. Why can the Public Health Information Institute not send behavior advice automatically with the heat warning on cell phones, as it is the case in Aurora, the capital of our neighboring country?
Well, you asked me something. We had preliminary discussions with the Met Office on this, and they are currently developing such a model, but for floods. Maybe you should call the Met Office on that one.
Thank you for the information. I'm going to do that. Have a good day. Bye.
Bye.
The National Meteorological Department, also called the Met Office, develops forecasts and communicates these to the government bodies and the media, as well as individuals who signed up for their services. Let's see how they can support me. Hello, this is Mayor Tony Francis from Genderbia. Let me get straight to the point. Aurora gets automatic advice on what to do with their extreme weather warnings. Can we have something similar in Genderbia?
Well, hello, Mrs. Francis. This is Mr. Garcia from the Met Office. We are still in the middle of changing to impact-based forecasting, and we are including behavioral advice. After the huge floods 2 years ago, the Met Office was asked by the Ministry of Interior to first focus on floods. But we are also worried about the new seasonal forecast. So maybe you can anyhow use our existing initiative?
Thank you very much, Mr. Garcia. It sounds like a very good plan. What is this initiative about? Can you tell me a bit more about it?
Sure. So there is ongoing work on a text message tool that will combine the existing warnings for floods that are sent out automatically with key recommendations for the population on how to behave and what to do.
Interesting. So it would be great if we can adapt that to heat waves, to alert the population about the heat wave and give useful tips on how to protect themselves and others.
Yeah, sure, that would be great.
And can this tool be a priority adapted to heat waves? So it would be ready for this summer.
Well, I will check with my superiors, and they could talk to the Ministry of Interior and also the Ministry of Health. And let me talk to them, and I will get back to you as soon as possible.
Thank you, Mr. Garcia. Oh well, time flies so fast. It's already the first week of July. And I'm very happy that Mr. Garcia told me that they will prioritize the new tool. The Met Office promises to put all mayors on a list of warnings. There's so much to do as a mayor in Genderbia. The temperatures have risen to unpleasant levels by now, and I'm sweating in my office. Hello, this is Mayor Tony Francis from Genderbia.
Hello, Mayor. Listen, this is Mr. Garcia from the Met Office. I'm just calling you because we have a new 10-day forecast just confirming that another heat wave is ahead of us.
Oh no, I wish I had more time. I need to call Carlo, the representative of all care homes of Genderbia. He still seemed a bit unclear about some things. And then I will set up a meeting with my heads of departments. We must do better this time. Thank you for the information, Mr. Garcia.
Good luck. Take care.
Hi, Carlo. How are you? Listen, I have bad news. There's another heat wave on the way, which will be probably starting in 10 days and could possibly even worse than the last one. Are you well prepared?
Thank you for calling, Tony. Yes, I think we're ready. So we considered some options. To all of you, it's important that you identify now all the options that Carlo and all the care homes should consider. So which recommendations do you think would be correct to further follow on? Should Carlo ensure, first, go to Slido please now, first ensure that the activity schedule is changed so that there are no outside activities. Second, install air conditioning in the common areas. Third, start a singing competition to distract from the heat. Fourth, instruct the care home staff to follow the guidance on ventilation and shading of the windows as highlighted in the manual of the Ministry of Health. Fifth, do an awareness-raising session with all of the staff on symptoms of heat and other relevant measures. Or sixth, serve more pudding after lunch to keep everyone happy. You have multiple answers. You can choose all of them, not all of them, as you like. Please vote now. The time is running. You see, already 3rd of July. So, Think fast, the poll is already closing. And 3, 2, 1. So, thanks a lot for voting. So let's go through it one by one. Let's start with the activity schedule. 64% of you thought it would be a good idea, so the majority thinks we should do this measure. Well, we will change it. What do you think about that?
Yeah, good choice, but we must keep in mind that the temperatures will also be high inside of the building.
That is true. This is why 58% of you thought that we should also install air conditioning in the common areas.
Yes, but this will take far too long, and to be honest, the contingency budget could not cover all care homes.
Yes, that is true. So we thought maybe starting a singing competition would be a good idea to distract from the heat, but actually not all of you agreed. Why?
Carlo, is this really your best idea? I doubt that the singing competition can distract from the heat.
Well, maybe you're right. Okay, let's look into the other options. Maybe we should instead instruct the staff to follow guidance on ventilation and shading of the windows. Most of you thought it would be a good idea.
That's a good choice, actually. Will you also move the common area to a more shaded site in the building during the day?
Well, we should. True, yeah. So then we have, least of all, also to serve more pudding after lunch. Again, not all of you voted for a yes, but we should keep everyone happy, shouldn't we?
With the pudding? I don't know what to say. I mean, I'm also in favor of pudding, but is this really your best idea, Carlo?
Well, you're right. Okay, so we go with the things you voted for, with those 4 activities, and we will install them in our care home and on all the other care homes. I will make sure of that.
But how about the excellence choice in this decision, about the awareness raising?
True.
You just skipped.
I just skipped it. You're absolutely right. So maybe we should also do that. All of you voted for a yes. We will do the awareness raising session with the staff on symptoms of heat illness, and so that everybody will be well prepared, of course.
Perfect, Carlo. I think you're on your way. Should be good.
Great. Thanks for filling me in. Bye.
Bye-bye. Now I have to set up a heat task force together with the departments of health, social welfare, environment, fire, and representatives of the public utility company, care facilities, NGOs, and the Red Crescent. The meeting will take place tomorrow, which will be 9 days before the forecasted extreme heat. Most participants know each other already from the first meeting, which I have set up after I received the seasonal forecast. However, it is lamented that many detailed questions are not yet prepared through standard operating procedures. This goes especially for the usage of water to cool down public and private places, office hours of cool public buildings, and for the usage of electricity to power air conditioning units. So, welcome. Dear representatives of the most crucial offices and partners of Grandørbia city government, I would like to thank you all for being here and supporting when it's most needed. Let us now work together on different solutions.
A few hours later.
Thanks a lot for your work and collaboration. Yes, I know our brains are now as hot as the weather is outside. I really needed the support from every single one of you. Now I present to you all the solutions we worked on. After that, we're going to talk about every option itself, and you can vote whether you want to pursue them or not. Because the heat wave is coming really close right now, we are going to make fast decisions. Unfortunately, due to the time delay of the live stream, only the on-site members and participants can take part in this decision-making right now. Here are the 7 options we have developed. First, we were discussing cooling down public spaces and squares through misting. The second option we came up with was setting up heat call centers. This should include incoming and outgoing calls. We were also thinking about installing additional public toilets. We could also coordinate emergency admissions with our neighboring provinces. The 5th solution was that we're going to set up mobile water distribution and cooling centers, including heat information for the public. Also, there was some suggestion about launching a volleyball tournament in the schools and taking advantage of the nice weather conditions. And number 7, we were thinking about open air-conditioned shops and restaurants for non-consumers to cool down. So now you will have the opportunity to vote on each suggestion individually. Should we pursue it or not? Open your Slido and you have 3 seconds to vote. So how about cooling down public spaces and squares through misting? Do you want to pursue this or not? Yes or no? Please vote now.
You have only a few decisions. The heat wave is coming fast, so the poll is already closing in 3, 2, 1. Thanks a lot for voting. We see a majority have voted for a yes, and that is a great idea. The measure is actually well taken. Generally, even if there was confusion about the city wasting water when there was a public call to save water. But anyway, the passerbys are enjoying the mist and the children are playing within it.
Nice. And the second option, is it a yes or no for the heat call centers? Please vote now.
So again, you have only a few seconds. Is it a yes or no? 3, 2, 1. It's closed again. We can see that the majority of you voted again for a yes. That is great. The call centers are well used for incoming calls. However, the social welfare department lacks a set of data with associated phone numbers due to data protection rules. So we don't have all the vulnerable people registered yet.
So what do you think about the third option? Should we install additional public toilets? Please decide now.
Again, you only have 3 seconds. Time is running fast. Is it a yes or no? Yes or no? 3, 2, 1. We see we are lagging a little bit behind. So again, here we see yes or no. Here we have the no. Majority thinks we don't need additional toilets, but maybe what the majority of you doesn't know is that senior citizens are usually not hydrating enough when they are not certain about clean and safe sanitation areas that are accessible for them. So maybe it would be a good idea to actually install them.
Thank you. So what do you think about coordinating emergency room admissions with our neighboring provinces? Should we collaborate with them? Vote now.
Again, yes or no? Do you want to coordinate? You have 3 seconds again. 3, 2, 1. And the poll is closed again. You can see many of you think we should actually coordinate. And I also think it is a great idea because the coordination with the neighboring and foreign provinces helps a lot to monitor the incoming patients as well as distributing them over to our hospitals in Medania and Auraria.
Great. So how about setting up mobile water distribution points and cooling centers, which includes heat information for the public? Is it a yes or no? How do you decide?
Again, you have 3 seconds. The heat wave is coming fast. Yes or no? The poll is closing now. I can see that almost all of you voted for a yes. Only 2% not. That's okay. So the cooling centers are installed and the water distribution points, and they receive many visitors around the heat waves.
Perfect. Okay, but honestly, so much stress, we all need a break. So is a beach volleyball tournament a good idea? What do you guys think? Yes or no?
Again, should we all go and play beach volleyball? Or at least the schools? Please vote now. You have 3 seconds. 3, 2, 1. So a majority again thinks, no, we don't need the beach volleyball tournament. Let us all hope that this proposal was only a joke, and let us not put the pupils out there in the heat.
So then the last decision. How about bringing in local businesses? Is it a yes or no for open up air-conditioned shops and restaurants for non-consumers? Is this something we should pursue or not? Yes or no?
Again, time is running fast. You only have a few seconds to decide. Yes or no, please vote now. The poll is already closing now. And with this one, you're not that sure. I can see now we don't have a clear majority, but still a majority. It is a clear majority, but not as the last ones. So let's take a look at it. If we do that, many people would report about this great initiative. Actually, because many shops get new publicity when the passerbyers who would usually not enter the shop actually do enter the shop, just to be in the cool, nice air. So, yeah, I think it would be a great idea.
Perfect.
All right. Now, let's see. We have installed many measurements, and the heat wave is coming fast. Actually, we've done it just in time. The heat wave is here now. And let's take a look at it, how Grand Urbia is doing so far. The heat impacted Grand Urbia massively again, to be honest. But you take a moment to look proudly at your achievements, all of you, with all your decisions. This city is much better adapted to heat this time than last summer. And the citizens are really using the installed opportunities to stay hydrated and cool, as you can see here. So these citizens also reflect that back to you. And there you should be really satisfied with all of your work.
So to be honest, this was an exhausting summer for me as a mayor. I'm really relieved that I managed to learn from last year. For now, I'm going to enjoy some ice cream, but I want to get back to work quickly, so my heat health action plan is ready for next summer. So thank you all for participating in this simulation exercise and stepping into the shoes of the mayor of Grand Urbia. I'm handing over now to our co-chair of the steering committee of the Global Health Hub Germany, Sophie Gepp, who is going to moderate the hot wash panel discussion focusing on heat preparedness. Sophie, please come up the stage. I'm going to introduce you really quickly. Sophie is a research associate at the Center for Planetary Health Policy. She holds a Master of Science, Public Health from the London School of Hygiene and Tropical Medicine, and is currently pursuing her medical doctorate at the research group on climate change and health at the Charité Universitätsmedizin Berlin and the Potsdam Institute for Climate Impact Research. Sophie, the floor is yours.
So I'll briefly introduce the three of you while you get ready in your seats. Firstly, Professor Dr. Anna-Katharina Hornidge is Director of the German Institute of Development and Sustainability, IDOS, and Professor for Global Sustainable Development at the University of Bonn. Professor Hornidge serves as expert advisor in several advisory boards at national, EU and UN level, as member of the German Advisory Council on Global Change of the German Government, the WBGU, co-chair of the Sustainable Development Solutions Network in Germany, and as chair of the section Research in the German UNESCO Commission. Welcome, it's a pleasure to have you. Then we have Dr. Peter Tinnemann, who is a consultant in public health and has been leading the public health office of the city of Frankfurt am Main since 2021. In 2022, he obtained his habilitation in the fields of social medicine and epidemiology at Charité Universitätsmedizin Berlin. So glad you can join us with your local perspective. And finally, Nathalie Nidens is a medical doctor and currently works as a research associate at the German Allianz on Climate Change and Health, where her work focuses on heat and adaptation measures in the healthcare and social sector. Welcome. So thank you all for joining us today, and after the audience shared some of their impressions of this exercise, I would like to hand over to you to maybe share your thoughts on the exercise, maybe something resonated with you or something from your experience that you could connect to that. And I'll start with you, Professor Hornidge.
Thanks. I tried to put into Slido that there was a lot of focus on coping and very little on mitigation and adaptation. But I failed to really put it into Slido, so thanks that I can share that now.
Maybe could you expand a little? What would you have liked to have seen, or what maybe is often left out of the conversation in your view?
I think it's often the case that we focus on the short-term coping, but forget about the mid-term and the longer-term strategizing. And with regard to the interface or the interrelationship of health and climate, or here heat, we have exactly that situation, that we sort of have a tendency to run after the crises and cope, invest into the short-term coping, while of course it's actually about taking steps that mitigate future risks and that prepare us systematically for future crises, through basically enabling and building our system capacities for adaptation, long-term adaptation, rather than short-term coping only.
Thank you very much for this reflection. I'll turn to you, Nathalie. I know you've been very involved in heat action plans, and so this must have resonated with you. Maybe you can share your thoughts with us.
Yeah, I find simulation exercises always to be kind of like a fun way to dive into a topic, to get into it, and kind of, you know, maybe make you think about things that you haven't thought about before without a simulation exercise. With this one, I found the pandemic that kind of has like crossed plans was kind of a realistic aspect, because that's what, in my experience, a lot of healthcare facilities, social facilities also struggle with. They're also kind of still recovering from the pandemic. But then on the other side, I felt like, okay, she started in April and she implemented a lot of measures. So that felt kind of like very optimistic.
That's a good point, yeah, thank you so much. And finally, Peter, you have the local health authority point of view. How realistic was that? And maybe you can add from your perspective.
Well, I haven't seen yet a mayor to actually do these things all by themselves. You know, that was quite interesting. Whereas we say in German, it's the Oberverwaltungsbeamte. You know, they usually get their administration together to do the work for them, give some advice. I think that was quite realistic. I believe in a lot of communities or local authorities, people are preparing for heat. I think we probably would get quicker into the crisis management mode. I think that is something that most authorities would now, specifically also with the Corona experience, get quicker into. What was very realistic is we don't really have yet good data. You know, we don't really, I mean, the decisions you were asking us to take was basically on a gut feeling. You know, what do you think is good? And I think that is something that we are lacking and where we need to get better at. That is something that we've also learned from the Corona pandemic. You know, we need proper data, live data, right away, dashboards, so that we can make evidence-based decisions. I think that's something that I want to see in the future.
Mm-hmm. Very interesting, because I was also thinking, oh, I wish I had more data, but that's probably, you always think that. And she also said, I wish we had more time. I think both of this is often something you think about. Yeah.
And more money, I think that was an issue as well. You know,
we could do
that
whatever
was very
we want.
Realistic. You know, I mean, most of the times we want to do stuff, but at the end of the day, it's kind of in the public administration, we don't have enough money, you know, and listening into the debate on financing health on a global level, I think the same issues is something that we're facing also at local level, you know?
Yeah. Maybe just to like stick onto that, you already mentioned lack of data and lack of resources as main challenges for local adaptation. Are there other things that you in the work for in the past year, but also preparing for the next heat wave, have faced as challenges locally?
I think increasingly we're getting political support. I think the issue has arrived in the political debates also on local level. And it's not only that the Minister of Health is aware of it, you know, it's also been in the local authorities. People are preparing for it, so that's something that is new. The issue of heat action plans, you know, I think they've been suggested more than 10 years ago by the environmental departments, but they've arrived now on local level and people are preparing for it. I think what we are lacking still is looking at how we can actually try to avoid some of the heating, you know. We're now thinking about doing public information campaigns on social media, but we need to be much more specific. Who are the vulnerable groups that will need attention of the local authorities? There was mentioning of we don't have a register yet of those vulnerable groups, and I mean that's true. You know, we don't know yet in the local authorities which are the old people, probably with chronic diseases that will need our attention, and we haven't really found good solutions for that yet. I mean, if somebody has good ideas on that, you know, please come after this to me and give us some advice. But I think that's something that we need to look at.
Yeah, really important point. Thank you so much. Nathalie, I'm moving on to you for a bit, like after the local perspective, you've been working with KLUG with several cities and have a bit overview on the national perspective. What are your insights regarding short, mid and long-term options to adapt a country or a region to heat waves, and how would you prioritize?
That is an interesting question, because of course in a comprehensive strategy you would include all kinds of measures, right? You had short-term, you had mid-term, you had long-term measures. And quite interesting, in Germany, what we've seen, well, after the guidance was published in 2017 for heat health action plans in Germany, a lot of measures were taking place which regard urban planning, which are long-term measures. And we haven't really focused on short-term measures yet. So what I personally think is that we need a two-pronged approach. So you of course, you need long-term measures, you need to kind of like the planning, you need to, the way you construct your cities, you don't want to get it as hot. That's the best thing if it doesn't heat up as much. And that also kind of like goes in hand with adaptation and mitigation measures. So in the long term, of course, mitigation measures are also heat preparedness, heat protection measures. But what we do see in Germany, for example, is that the healthcare facilities, social facilities, kindergarten, schools, all these sorts of institutions, they do not have their own concepts in place yet. I mean, we're starting, there is more political support. It is, starting to rise. People are starting to get aware of it. But we do need short-term measures now. And I wouldn't say we do need only coping, but we do need to protect people now because people are dying this year, last year's, and this is not a problem of 20, 30 years from now. So we need kind of like these both approaches, and really there needs to be a rethinking also kind of like social norms, If we think about traffic, when you cross the street, you look left or right. But when we think about heat, do you think about, the elderly person living in your house? You don't really, or sometimes you don't even think you're vulnerable, even though you are. So there really needs to be, I think a rethinking of heat as a threat and also on what we can do and that we can protect ourselves, combining all different kinds of approaches.
Yeah, and maybe add to that, that's also a big part of communication. I think now has shifted from newspapers depicting people at the beach for talking about a heat wave to really depicting, the health impacts.
Yeah, and maybe something also regarding the long term, because resilience, I think, is such an important thing. Our healthcare systems are, they are already working overtime and overboard, and then you have another task, at least that's how a lot of people feel in the healthcare sector, like on top, and you do have staff shortages, and so it's kind of like making all of our systems more resilient, even if you look, beyond climate change and health, just generally. Yeah. I think that would be kind of like one of the main tasks, really.
Yeah. Thank you so much for that. I'll move on to you, Professor Hornidge. You have a very broad international perspective, and I would really like to weave that in. In the simulation exercise, we've learned the importance of intersectoral cooperation. How can different sectors enhance their collaboration and take a cross-sectoral approach? And how can we maintain dialogue? And maybe what have you seen in other countries in your work?
Yeah, thanks. Maybe let me start with political will. That's something we saw in this exercise. There was substantial political will, which of course is sort of a good basis to start from, and that is not always the case, so it should be underlined as well. And also then, of course, the aspect of shared responsibility. When we think about coping or mitigating, coping, adapting, if you think about all these activities that have to take place at the same time, we also, in a system such as in Germany, but also internationally speaking, can reflect on who has the responsibility or the immediate responsibility for what. Of course, in the end, everyone is responsible for all three areas, but still, there's an element of shared but differentiated, to use the term out of climate politics, shared but differentiated responsibility. And what I mean with that is, internationally speaking, when we think about the interplay of ecological, climatic crisis effects and health crises, and then sort of think of the different multilateral fora that we have on the regional level, but also then on the multilateral level for acting, then I think it's very clear that a club format such as, or an alliance such as the G7 has a different responsibility to invest into long-term strategies for adaptation, but also for mitigating, than countries that whose systems capacities are simply substantially more limited, and where the focus on short-term coping is basically built into the systems and also understandable to a certain degree. If you look at or remind ourselves of the map that we just saw before by Mr. Rockström, then it's very clear that the countries especially affected are often also countries with less system capacities being available for then taking a long-term perspective to mitigate. And then, of course, I think it becomes very relevant to reflect on the different governance fora that we have, and that can also have to strengthen each other. I mentioned the G7. Well, the G7 is part of the G20. The G20 is the constellation where actually the music of the future is playing, because that's where the large part of the world society is actually living, and where a lot of change is happening. So, you know, we always have to sort of reflect on how do these different governance fora interact in order to take care of coping, adapting, and mitigating. I should have mentioned that first. And of course, then there's UN and the WTO, etc., etc.
Yeah, thank you for these insights, and also for reminding us for the about the common but differentiated responsibilities for the global public goods that we have, be it global health, be it the climate. I will pass on to you in the audience in a second, so please already get ready. And I have a short question for Peter before we do that. We heard the mayor rang another city. How often does that happen? How often do cities on the ground collaborate in heat waves?
Well, we have a meeting amongst the largest public health office directors. So we have frequent exchanges, at least every 3 to 4 months. And we've picked up the issue of climate change last year and looked into what the city should do. So that's there, but we don't really have it on a local level. You know? We meet on regular basis amongst all directors of public health offices for the states, you know, so that's happening. But I want to make one more point to what's been said before, you know, because I was up in arms last week, and I was meeting with the director of the city planning office in Frankfurt. You know, I said, hey, listen, you know, you have all these plannings, and you need to get health into that as well. You know, health is very important. Climate crisis coming. You know, when you build something new in Frankfurt, we need to be there as health specialists, etc., etc. And he's like, yeah, right. That's happy to do that. You know, but you know what? The stuff we're planning is only less than 1% of new constructions that we're doing, okay? So 99% of the city is already built. So the question, if we look at medium or long term, is which parts of the cities are we reconstructing or maybe taking down, right? Because the cities, as we've built them in the last decades, are probably not suitable anymore for the climate that's coming. So the question is not only like, which little bits and bobs of the 1% that we're building, are we building differently and look under health aspects? The question is, how many of the 99% of the city are we actually maybe demolishing, right? And who's going to be kicked out of his house? I mean, this is sort of a question that hit me right in the face, you know? So when we theoretically discuss these things as, oh, we need to look at medium and long term, how we can actually look at the city planning and stuff, you know? I mean, this is the really ugly part of the planning, of the long-term planning. And I think we need to take that into account as well.
Can we react?
And maybe I'll take the questions, and you can weave in your reaction with the questions. Is that an option?
Right.
Are there questions in the audience? I see one. Yes.
Yeah, thank you, Andreas Wolf from Medico International. I just jump on this, what Peter just said. I think this urban planning thing is very crucial, and living now here in Berlin, we see that there is a densification process going on. I don't know how much this 99% and 1% is, but what is happening in Berlin is that because of the very agile real estate market, and everybody wants to go to Berlin, so you see a lot of new constructions basically in the middle of existing quarters, so really occupying the last bits of free spaces, which is obviously completely counterproductive if you look at it at the perspective of heat waves. So I'm not sure how much, like you have to really push strongly to interact maybe also with the real estate people to say this is not what's going to happen. I think you are, and of course there might be other options for building to do these green facades and rooftop gardenings or something like this. That might be an option also for cooling. But really, it is not just about the health politics. but how to really do this health in all policies as the public health community always claims. To what extent you really have also a realistic power and to change things?
Thank you so much for your comment, and I think that works well with your reactions. Maybe you, if you want to add your reactions before.
Yeah, so first I wanted to say this is actually quite an interesting thing, because as we heard with Professor Rockström, the social justice dimension, right? So who lives in a part in a city that is heating up, where there's a lot of concrete, a lot of like tall buildings? Probably people who might, or at least in some of the German cities, who might have like a lower socioeconomic status, right? So this is once again kind of like the social dimension that hits. And this is just something that I wanted to note, so I'm not disagreeing with you there. But I feel that heat, of course, is a perfect example for a heat or health in all policies approach. And this is also something that I think might be a barrier at the moment in Germany as well, that we kind of like work in silos also in authorities, right? So, and when you want to approach this topic, you need to have trans-sectoral, cross-sectoral, interdisciplinary exchange and collaboration within the authorities, so with state actors, but also with non-state actors.
Any further reactions to the comment? Do you want to add anything? Okay. Any other questions? I see one in the chat otherwise. Then I'll take that. There's a question on the water crisis and extreme heat. So how do we consider the implications for health and adaptation plans and resilience, given that we've heard that the access to water is such an important part of heat health action plans? Maybe someone of you could comment on that.
No,
Maybe,
sorry,
yeah.
I'm jumping back a bit, but I just want to come back to the health in all policies remark by the colleague. I mean, I thought it was very interesting just before in the presentation by Mr. Rockström, how he underlined, and I would agree with it, that health can act as a vector. It can remind us of the urgency to act because it's so personal, it affects people so directly, etc., etc. And that's also an argument that the WBGU is pursuing. At the same time, we also know, and he showed us the data, that while that was true with the COVID-19 pandemic, with a crisis situation, it's not true when we think of creeping disasters, creeping health disasters, such as air pollution. Yeah, and that is, of course, an understanding that we also know from other fields with regard to climate change adaptation or living with the effects of climate change, that it seems to be for our societies a lot easier to act when there is an immediate urgency rather than when it's a creeping disaster that sort of slowly builds up. Yeah? So the construction of crisis, discursive construction, social construction, political construction, also through the media, of course, is important because it creates or contributes to this understanding of urgency. But of course, there's a limit to that. Of course, if we constantly engage in a deficit-oriented crisis discourse, then it loses its edge. So, you know, coming back to the health and all policy argument, while I very much agree, there is, of course, a limitation to it, because the understanding that health effects immediately create a higher level of sensitivity for then actually taking action, so to say, on the political level, only seems to be true for the crisis-driven or crisis sort of health crises, rather than for the creeping disasters. And of course, there a justice element is immediately built into that question. Who is able to construct a crisis more effectively, basically, than those who aren't?
Yeah, and we've also seen this with health security, which diseases are perceived as crisis and which are not. And this is of course a justice perspective and a power dynamics. Yeah, thank you so much. Since we're already running quite out of time, I would now come to the final rounds, and I would maybe start with you, Peter. What would you need from other authorities and stakeholders to better overcome the challenges that you mentioned before and to prepare for the heat waves? What, if you had 3 or 2 magic wishes, what would they be?
Well, I think One point was that Andreas already made. You know, we need to look under the idea of health in all policies, who is responsible for what, and how do we actually interact with each other. Gather some better understanding from how we work within the city authorities, but also with civil societies and researchers. We haven't really established those links yet, especially with the outside world, if you want to say so. But I think that's important, also lessons that we learned from the corona crisis. What is really important is, point I made before, is we need data. We need live data. The question that came also up in the exercise, how many people are in the emergency room? You know, how many old people are still there that might end up in the emergency room? This kind of live data we need to have, and we need to be much, much better on that. And I think that is something that where we can work closer with academia, with civil societies and others, and hopefully digitalization will help us there as well to get a bit of head of the curve, as we always say in crisis management. Thank you.
Yeah, thank you so much for really making that clear. And digitalization is also one of the topics that the Global Health Hub will be talking about more in the coming months, and I hope also with regards to this topic. Nathalie, maybe also what would be your two recommendations to local and regional actors, but also I know that tomorrow there's a special day coming up that you and KLUG try to raise awareness around heat and heat health protection. So maybe you can share a little bit on that as an outlook.
All right, so regarding the first question, I think one of the things is prepare. You know, like don't wait for the summit to come. So for like the mayor, now's the time, the heat wave's over, but you need time to evaluate your response. Also, what did you want to implement? What did you implement? What worked? What didn't work? What other structures do you need to have in place? You need data kind of, you know, like you need to implement that into your response and your reaction. And one of the main things is that we also at KLUG kind of like try to push is really getting the non-state actors, the people that are, you know, nurses, doctors, people working with homeless people, kindergarten teachers, get those people on board because you really need to try to reach, you know, a lot of the vulnerable people. And an authority, a government itself can't do that. They do not always have the access to those groups. And just generally try to raise the level of awareness also among the people to kind of, you know, also, you know, look after people that they know that that might be belonging to one of these vulnerable groups, but are not kind of like taken care of in an institution, right? So there are lots of people that you will not get by institutions. And that's also need like a lot of like civil societies and just generally the entire population to all work together. And the other thing is, tomorrow coming up is a nationwide heat action day. We already have events taking place around this day. So today there will be a event for doctors who work in an office or office people working in those offices. There will be awareness raising campaigns. There will be a lot of activists coming up tomorrow. And today there was actually one of the press conferences together with the Minister of Health, Lauterbach, and the Chamber of Physicians, I don't even know the English translation, Deutsche Pflegerat, and KLUG. And tomorrow coming up will be an event at the Chamber of Physicians, highlighting what we also need to do on a political level. So really saying politics, take up speed.
Fantastic. Thanks for both the individual and broad societal recommendations. Also great to see that civil society actors and a broad spectrum of actors that are working together are really addressing this now in Germany. Professor Hornidge, I also have two questions for you. Firstly, about the recommendations. What recommendations do you have? And I know that you regularly advise governments, so what recommendations do you give to them? And I also know that the Global Council, the WBGU, the Wissenschaftlicher Beirat für globale Umweltveränderung, is launching its Hauptgutachten tomorrow. So maybe you could share a little bit on that.
Yeah, thanks. I can't jump ahead, but I do want to advertise. Basically, the WBGU, we are submitting our book, Hauptgutachten, that we've written for the past 3 years on the interrelation of environmental changes and health. Human health stands at the center, but of course ecosystem and animal health is also part of the of the book. And we submit it tomorrow, hand it over to the government. So the federal press conference is taking place tomorrow with Minister Lemke, as well as State Secretary, sorry, I have to look this up because it changes, or it just changed, State Secretary Pirscher from the Research and Educational Ministry. But then there's a public event also on Monday in which we discuss the whole book with quite a range of different actors. It's a joint event with the SRU that is also submitting its report, and we jointly basically bring them together or into dialogue with each other. The WBGU work takes on a slightly more international perspective. The SRU work focuses on the national context. And we bring both reports, both recommendation reports together with the aim to discuss it with the different actors from BMZ, BMBF, and BMG, basically. Well, maybe as a little taste, of course, we are very much buying into or underline very much the urgency to act. We've engaged with a number of concepts that have been floating around the room here as well. Health and all policy was just now mentioned. We of course formulate recommendations with a focus on environmental policy making as well as research and science policy making. That's what we are. That are the two houses that largely that appoint us. But then, of course, also address the health ministry, the development ministry, and a number of others, and then move up basically to the European Union level and the multilateral level. I won't, I can't give away more, but please stay tuned, and we hope to discuss with you further. Thanks.
Thank you so much for joining me in this panel, for sharing your reflections, your expertise from local to international, and to also giving us a glimpse of what is already all happening as activities, what is to come, and also the call to action for everyone involved in health to be active in this field and to protect themselves and others from heat. Thank you so much. We'll be breaking for lunch now. And thanks to all the panelists and to all of you listening. And I'll hand over to Christina now.